Now, fighting Lyme. The tick-borne disease affects hundreds of Rhode Islanders each year, and chronic cases can be debilitating.
The number of people with mosquito-borne illnesses, however, are in the single digits.
But we found the state spends nearly 8 times more money on mosquitoes than ticks.
And tonight we're sitting down with a West Greenwich man who spent years just searching for a diagnosis and months after that battling Lyme disease.
Eyewitness News reporter Kelly Sullivan is here now with his story.
Shannon and Mike, every year the CDC estimates that 300,000 people are diagnosed with Lyme disease. In 2015, Rhode Island reported more than 900 cases. And doctors say it can be very difficult to diagnose, and in some cases it goes unreported. I sat down with a recent URI graduate who visited more than 20 doctors to finally confirm he was living with a debilitating disease.
Dan Lennon ran marathons, did the Blessing of the Fleet every year, and this 26-year-old graduate from URI was also on the hunt for a new job, until his world got turned upside down.
I never saw a tick bite, to be honest with you. I just started feeling tired, I was achy, and I said I was having trouble standing on my feet.
Confused as to what was happening, he saw a doctor, and another, who couldn't pinpoint what was wrong with him.
And that's why, unfortunately, I saw 20 different specialists over 2.5 years, including some of the best hospitals in Boston. And I still came up empty, you know, rheumatology, immunology. They kept saying, well, be grateful that you don't have MS, be grateful you don't have ALS, and I was, but I still didn't feel like myself, so I didn't know what to do.
It would finally be a doctor in Connecticut, the state where Lyme disease was first recognized, where Dan was finally diagnosed with chronic Lyme disease.
Not only did I have Lyme, but I had 2 co-infections that are deadly, and it wasn't until I treated that I started to get my health back.
Months of IV antibiotics pumped into his body, mountains of medication, and hours of sleep chipped away at Dan's everyday life.
Well, how did it affect you socially?
Socially, it's completely isolating. It's unbelievable.
Dan learned through the process he had to advocate for himself. Infectious diseases physician Dr. Timothy Flanagan says tick-borne illnesses often go unrecognized with symptoms that are similar to the flu.
Our tests for Lyme are helpful, but they're not perfect. And so early on, you can have a negative test even. And so it's important that all of the care providers in the state be aware of Lyme and other tick-borne illness, and oftentimes treat it early.
Acute Lyme can usually be cured in a month, but the road to recovery for chronic Lyme is typically much longer.
A lot of medical providers aren't sure what type of care to give because there's confusion out there. And so therefore you get a very contentious relationship with patients and doctors. Doctors say, I don't really believe this is real. Patients say, wait a second, I'm suffering. I know I had Lyme. This is a terrible situation we're in.
A year of treatment, and Dan is starting to feel a lot better. He also has hope of helping others get through this debilitating disease that affected 904 Rhode Islanders alone in 2015.
I really think there needs to be more outreach. You know, I don't think there's enough of that, and I hope I can change that.
And so Rhode Island spent $10,000 for education and outreach for Lyme disease this year. That's compared to the $78,000 spent on mosquito abatement programs. And so far, there have been 2 human cases of West Nile virus and 0 human cases of EEE this year. Now, coming up new at 6, what a local doctor says needs to be done to bring down the number of Lyme disease cases. I'm Kelly Sullivan, Eyewitness News.